Hi there, I'm Dr. Jesse Ehrenfeld. I'm an anesthesiologist and a person who for a long time has been deeply interested in understanding how technology can help both doctors and patients make better decisions. You see, it turns out that the world we live in is complex, and that complexity is growing along with our understanding of both health and disease and how to keep people healthy. The problem, though, is that there's just too much to know. There was once a time when physicians could keep up with all that they needed to know. There were just a handful of journals. You'd read the ones relevant to your field, pop in a review course every now and then you'd be all taken care of. This is simply no longer the case. In 2015, there were over 22,000 articles published and indexed just about anesthesia. That's more than 60 articles a day, or a new article every 24 minutes. So as we collect more information and generate new knowledge, what is a physician to do? The answer is we have to develop technology that can bring the right information to the right person at the time when it will be needed. And that's what my team does. The Vanderbilt Anesthesiology and Perioperative Informatics Research, or VAPIR division, is a multidisciplinary group of physicians, biomedical engineers, software developers, database analysts, and other research staff who focus on understanding how the utilization of information technology can improve perioperative, anesthetic, and surgical outcomes. Now, the group, which is a part of the Vanderbilt Department of Anesthesiology, has been recognized as one of the premier anesthesia informatics programs in the world. Our group manages a variety of clinical research projects that span many areas: development of real-time point-of-care notification systems, creating predictive models for patient risk stratification, enhancing patient-provider communication, developing new models for delivery of medical care, and bringing personalized medicine into the operating room. Now, currently, our team has more than 40 active research projects with collaborations that extend across Vanderbilt and into a dozen or so academic centers across the world. Our work is focused on using information technology and advanced analytics methods to bring information to the right person at the time when it will be most needed. And this is a concept called process monitoring and process control. Now, let me give you 3 quick examples. First, just last week, I was taking care of a 57-year-old lady in the operating room who needed her hip replaced. Now, halfway through the case, there was a drug that needed to be redosed, but this was a drug that I hadn't used in a while. And I wasn't totally familiar with the latest recommendations about how it should best be used in this particular circumstance given this patient's comorbidities. Not realizing that I needed to do something, the system alerted me, and that it was time to redose this medication. The patient got what she needed after I got a little help from our system that our team helped build and evaluate for providing real-time point-of-care recommendations. Now, the second example is around a system our team developed to help automatically scan the electronic record and highlight issues that might be buried deep in a note or otherwise not recognized by a team caring for a patient. This system looks at all of our patients who are scheduled for surgery the night before, finds key issues that might go otherwise undetected, and sends an email to the team caring for the patient. The team is then able to use that information to adjust their plans as needed. Finally, it's hard for us to keep track of how all of our patients are doing, especially for anesthesiologists who might not see a patient once they leave the recovery room. So we've developed a system that scans through the electronic record for downstream outcomes and then alerts the team when something is detected. So if my patient has a myocardial infarction 48 hours after surgery, or shows up in the emergency department as a result of a surgical complication, I get an immediate notification which allows me to improve my practice in an ongoing and continuous fashion. I love what I do, and we have seen better outcomes for literally thousands of patients both here at Vanderbilt and in other centers around the world that have adopted the technologies that we have built. The world is a complex place, but with technology, we can better manage that complexity. Thanks, and feel free to reach out if you have any questions about our work.